I hope I am audible to you. Good evening to all. Good evening to all. I hope I am audible to you. Good evening to all. I hope I am audible to you. Good evening to all. I hope I am audible to you. So today we'll see the remaining part. This is the part second of your anticoagulants. Good evening to all. I hope I am audible to you. And today we'll see the second part of your anticoagulant. We have already seen the blood from anatomy physiology point of view. After that we were started with the coagulant, anticoagulant and thrombolytic. So we have already completed one lecture on that, right? We have completed one lecture on it, that is about the introduction and classification part. So we have seen the blood coagulation process. Again, very important. Remember the blood coagulation process. After that we have seen the anticoagulant classification. So in that we have seen the parenteral anticoagulants and oral anticoagulants. In the parenteral you have indirect thrombin inhibitors. So indirect thrombin inhibitors means all the heparin and its derivatives like heparin, low molecular weight heparin, then fondaparinux and danaparide. After that we have seen second class in the parenteral direct thrombin inhibitor. In that lepirudin and bivalirudin, argatobran. After that oral anticoagulant, in that coumarin derivative means citrus, coumarin, warfarin, acenocomerol. Then direct factor 10 inhibitor, rivaroxaban, and oral direct thrombin inhibitor, dagibatran xylate. And in vitro heparin is in vivo as well as in vitro. Then sodium edetate, sodium citrate and sodium oxalate, they are known as a in vitro anticoagulant. Okay, so that we have also seen the fibrinolytics means tissue plasminogen activator, streptokinase obtained from streptomyces, urokinase obtained from urine, and these are the recombinant DNA technology made tissue plasminogen activator. Antifibrinolytic, in that you have EACA, epsilon aminocapric acid and tranexamic acid. Antiplatelet drug, in the detail today we are going to see. Okay, so in that also you have 5 classes. So thromboxane synthesis inhibitor, aspirin, platelet cyclic GMP enhancer, dipyridamole, or it is also known as a phosphodiesterase inhibitor, PDE inhibitor, it is a dipyridamole. Then P2Y12 receptor blockers, also known as ADP receptor blockers, ticlopidine, clopidogrel and prasugrel. GP2B 3A receptor antagonist or collagen receptor antagonist, they are abciximab, iptapibtide and tibropipam. After that we have seen this. So what are the different drugs used in the coagulation, blood coagulation disorders? So procoagulant means they will assist the coagulation process. In that you have these drugs like adrenaline, thrombin, fibrin, gelatin form, astringent and vitamin K. So thrombin and fibrin, these two are nothing but the blood clotting factors. Gelatin form, astringent and vitamin K. Anticoagulant, we have seen the classification in the detail. Okay, so antiplatelet drugs, remember we are going to see the today details of antiplatelet drugs. Aspirin is there, dipyridamole is there, ticlopidine, clopidogrel, abciximab, iptapibtide and epoprostenol. Antifibrinolytic, they will break down the देखो, there are two terms, fibrinolytics. Fibrinolytics means thrombolytics. They will break down the thrombus. जो थ्रोम्बस होता है, जो क्लॉट होता है, फाइब्रिनोलाइटिक और थ्रोम्बोलाइटिक, they will break down this clot. They will break down this clot. That's why fibrinolytics or thrombolytics. Streptokinase, urokinase, alteplase, reteplase, and histoplase. Then anti-fibrinolytic means they are opposite to this. So anti-fibrinolytic means they will act opposite to the fibrinolytics or thrombolytics. So they will assist basically the coagulation process, and they are nothing but the epsilon aminocapric acid, tranexamic acid, and apoproteinin. We have already seen this classification yesterday also in the last lecture. Okay, so today we'll see the antiplatelet agent. This classification also we have seen. We have also seen this classification. Now, why I am taking this classification repeatedly? Because it is important, and multiple times question they used to ask on a classification. बहुत बार classification से question आता है, that's why we are repeating it. नहीं तो मुझे कोई शौक नहीं रिपीट करने का. Anticoagulant may be either parenteral given by injectable route, may be either oral. Parenteral anticoagulant, in that you have direct thrombin inhibitors like iridine, lepirudine, bivalirudine, argatroban, and melagatron and dabigatron. Then indirect thrombin inhibitors, in that you have all the heparin derivative. So heparin, low molecular heparin, and fondaparinux and idraparinux. Then oral anticoagulant, in that first vitamin K inhibitor. So vitamin K inhibitor is a coumarin anticoagulants, in that warfarin is there, in that dicoumarol is there, in that acinocoumarin is there, and phenandione. So they inhibit the vitamin K epoxidase enzyme and prevent the activation of blood clotting factor, which are vitamin K dependent. Direct thrombin inhibitor, in that zimelgatran, dabigatran, etaxalate. Direct thrombin inhibitor, which are oral. Now we have already seen this. Anticoagulants, they will act on either platelet aggregation, or they will act on a thrombus formation, or they will break down the clot, or they will break down the thrombus. We have seen this in the yesterday's session, right? So in the last session we have also seen the blood clotting factors. Remember, there are 16 blood clotting factors, and multiple times I am repeating this because a lot of questions they used to ask. Factor 1 is known as a fibrinogen, factor 2 is known as a prothrombin. All they are the glycoproteins, they are the inactive glycoprotein in the blood. Factor number 3 is known as a thromboplastin, also known as a tissue factor. Factor number 4 is known as a calcium. 5 is known as a proaxelrin or labile factor or activator globulin. Factor number 6 is a axelrin or active factor of factor number 6. Factor number 7 is a proconvertin. Then factor number 8 is anti-hemophilic factor A. Factor number 9 is a Christmas factor. Factor number 9 is Christmas factor or anti-hemophilic factor B, also known as a plasma thromboplastin component PTC. Factor number 10 is a Stewart power factor. Factor number 11 is a thromboplastin antecedent component PTA, plasma thromboplastin antecedent component, also known as a anti-hemophilic factor C. Factor number 12 is known as a Hegman factor. Remember, 13 is known as a fibrin stability factor or fibrinase or von Willebrand factor. Factor number 14 is known as a precalcikyrin, 15 is known as a calcikyrin, and 16 is known as a platelet factor. So And vitamin K dependent blood clotting factors are nothing but the factor number 2, then 7, 9 and 10. 2, 7, 9 and 10. इसके ऊपर भी क्वेश्चन ऑलरेडी आ चुका है. We have already seen this. Again, now we have seen thrombogenesis means what? Thrombogenesis is the clotting of blood. Thrombogenesis means a pathological condition where there is a formation of clot inside the blood vessel, है ना. अगर नॉर्मली ब्लड वेसल के अंदर क्लॉट बनता है तो दैट इज पैथोलॉजिकल कंडीशन नोन एज थ्रोम्बोजेनेसिस. इट इज प्रिवेंटेड बाय नॉर्मल वेस्कुलर एंडोथेलियम. ब्लड वेसल का जो इनर लेयर होता है दैट इज स्मूथ, प्रिवेंटेड बाय स्मूथ एंडोप्लाज्मिक स्मूथ वेस्कुलर एंडोथेलियम. आल्सो प्रोस्टाग्लैंडिन I2 PGI2 प्रोस्टासाइक्लिन्स, एंटीथ्रोम्बिन 3, प्रोटीन C, then heparan sulfate and proteoglycan. These are the compounds which prevents the thrombogenesis, which are natural anticoagulants in the blood other than heparin. तो यहाँ पे स्मूथ एंडोप्लाज्मिक स्मूथ एंडोथेलियम ऑफ ब्लड वेसल, प्रोस्टाग्लैंडिन, एंटीथ्रोम्बिन 3, प्रोटीन C, heparan sulfate, then proteoglycan, protein yes, then also again one more factor heparin, right, and rapid flow of blood. So these things inhibit the blood clotting normally. Drugs which are used to prevent the thrombosis, okay, drugs which are used to prevent the thrombosis is known as they are nothing but the antiplatelet drugs. Drug which prevents the thrombosis, they are known as the antiplatelet drugs. Then also hemorrhagical agents, they will change the rheology of blood. Anticoagulants, thrombolytics. So basically you can say the drug acting on blood can be studied under these headings like antiplatelet drugs, hemorrhagical agents, anticoagulants and thrombolytics, right? So next we'll see, so okay, now antiplatelet drugs, how they will act, mechanism of action of them. So basically in the platelet you have cyclic AMP. Cyclic AMP from the platelet has an important role in the प्लेटलेट एग्रीगेशन. साइक्लिक एएमपी जो होता है उसका एक इंपॉर्टेंट रोल होता है प्लेटलेट एग्रीगेशन में. प्लेटलेट एग्रीगेशन इज द फर्स्ट स्टेप्स टुवर्ड्स द ब्लड क्लॉटिंग. प्लेटलेट एंडोथेलियल प्रोस्टाग्लैंडिन आल्सो स्टिमुलेट एडेनिल साइक्लेज. प्रोस्टाग्लैंडिन जो होता है प्लेटलेट एंडोथेलियल प्रोस्टासाइक्लिन स्टिमुलेट द एडेनिल साइक्लेज. एंड एडेनिल साइक्लेज जब बनता है सो देयर इज अ फॉर्मेशन ऑफ cyclic AMP, thromboxane A2 and decrease in the cyclic GMP. मतलब formation of cyclic AMP, thromboxane A2 and low way. So दिस एडेनिल साइक्लेज, जब प्रोस्टाग्लैंडिन एडेनिल साइक्लेज को स्टिमुलेट करता है वो साइक्लिक एएमपी बनाता है, थ्रोम्बोक्सिन A2 बनाता है, देन एंड साइक्लिक जीएमपी कम करता है. एंड थ्रोम्बोक्सिन A2 साइक्लिक एएमपी ना, थ्रोम्बोक्सिन A2 साइक्लिक एएमपी साइक्लिक जीएमपी ये प्लेटलेट को इनिबिट करते हैं, प्लेटलेट एग्रीगेशन इनिबिट करते हैं. नाउ हाई इंट्रा प्लेटलेट साइक्लिक एएमपी, अगर प्लेटलेट में साइक्लिक एएमपी ज़्यादा है तो इट इनिबिट द प्लेटलेट एग्रीगेशन. हायर लेवल ऑफ साइक्लिक एएमपी इन द प्लेटलेट इनिबिट द प्लेटलेट एग्रीगेशन, वेयरएज लो लेवल स्टिमुलेट द प्लेटलेट एग्रीगेशन. अगर साइक्लिक एएमपी कम हो गया प्लेटलेट एग्रीगेशन बढ़ जाएगा, ज़्यादा हो गया तो प्लेटलेट एग्रीगेशन नहीं होगा. एबनॉर्मल ब्लड क्लॉट्स आर मोस्टली ड्यू टू द एबनॉर्मल सिंथेसिस ऑफ प्रोस्टाग्लैंडिन. मोस्ट ऑफ द जो क्लॉटिंग होता है इनसाइड द ब्लड वेसल दैट इज बिकॉज ऑफ द abnormal synthesis of prostaglandin prostaglandin. Apart from this, endothelial nitric oxide, endothelial layer of blood vessel also releases the nitric oxide, also increases the cyclic AMP level in the platelets and inhibit the platelet aggregation. Now coagulant क्या होते हैं? Coagulants means these are the drug which increases the blood coagulation. These are the drug which helps to coagulate the blood. ऐसा नहीं कि आपके अगर ब्लड वेसल में कट आ गया तो ब्लीडिंग होके आप मर जाओगे. There should be coagulation. So if bleeding does not stop, so procoagulants they are used to control the bleeding. तो coagulants में आता है आपका विटामिन के. विटामिन के there are derivative like vitamin K1 is a phyloquinone. Vitamin K1 is a phyloquinone which is from plant origin, and vitamin K3 is a menadione which is a synthetic in nature. ये synthetic है. इसके ऊपर क्वेश्चन भी आ चुका है. Which vitamin K derivative is a synthetic purely? So vitamin K3 is a synthetic in nature. Vitamin K1 phyloquinone is a from plants. So they are used as a coagulant. Fibrinogen is a blood clotting factor. Desmopressin also released, that is also important for coagulation. Anti-hemophilic factor, and adrenochrome monosemicarbapenem, that is a drug. And ethamsilate is a drug. Rutin is a glycoside from plant. So routine glycoside है, then ethamsilate, adrenochrome monosemicarbapenem. These are the drugs which helps to blood to coagulate. Okay? Now these drugs act as a coagulant. Immediately they will restore the hemostasis. Vitamin K will discuss in the vitamin chapter separately again. Okay? तो विटामिन के का केमिस्ट्री, उसका रिक्वायरमेंट्स, वो सब when we will discuss the that chapter known as vitamins, at that time I will explain you vitamin K. Then human fibrinogen, human anti-hemophilic factor, all they are used as a coagulant. Now desmopressin is responsible for the release of desmopressin responsible for the release of factor 8 and von Willebrand factor. Desmopressin क्या करता है? It stimulates the release of von Willebrand factor and factor 8, that is anti-hemophilic factor A. Now adrenochrome semicarbapenem जो drug है, that reduces the capillary fragility. Capillary blood vessel के जो fragile बनते हैं तब coagulation होता है. So decreasing the fragility, improving the blood flow, rheological properties of blood, prevent the micro vessel bleeding. Now routine क्या है? Routine is a glycoside from the plant that also reduces the capillary bleeding, and it is combined with the vitamin C. नया ड्रग है एक और, ethamsilate. Ethamsilate again reduces the capillary bleeding by correcting the abnormalities of platelet adhesion. Platelet aggregation होता है, उसके abnormalities clear करके ethamsilate act as a coagulant. So there is one tablet known as a Silate 500. का एक टैबलेट होता है Silate 500. Silate 500 उसमें ethamsilate होता है, that is used to control the bleeding in the women's. Procoagulant, that's why. Now local hemostatic or styptics. Local hemostatic or styptic. Local hemostatic or styptic मतलब क्या? So they will be applied locally to prevent the bleeding. Local hemostatic or styptics. So they are basically vasoconstrictor agents. जैसे एड्रेनालिन हो गया आपका, जिलेटिन फोम हो गया, ऑक्सीडाइज्ड सेलुलोज हो गया. They provides the rough network which activates the clotting factor and stops the bleeding. So coagulants जो है they are used to prevent the bleeding, है ना. and in that you have different blood clotting factor, desmopressin, then adrenochrome monosemicarbapenem ethamylate, and routine. Remember, okay? And local hemostatics means local styptics. Now antiplatelet drugs, देखो, resting platelet means they are not activated, resting platelets. So in case of healthy endothelial cell, there is a resting platelet, but they are not activated, they are not aggregating, you know. So if there is a damage to the endothelial layer, so they will be activated. So there is a platelet adhesion. So activated platelets covers and adhere to the exposed subendothelial surface of damaged endothelium of blood vessel. So they will get activated. Platelets क्या होंगे? Activate होंगे and releases the chemicals like thromboxane A2, ADP, and 5-HT serotonin, platelet activating factor. Now what are these? All these chemicals, they are responsible for the platelet aggregation. These factors will promote a platelet aggregation: thromboxane A2, ADP, serotonin, platelet activating factor. So that leads to platelet aggregation, and more platelet are recruited into the platelet plug. Once a primary platelet plug is formed, once a primary platelet plug is formed, so in that platelet plug thrombin will bind, and thromboxane A2 and other ADP platelet, then serotonin, they ADP and other what collagen of subendothelial, they causes the increase in the calcium level. Calcium also brings about the more aggregation of platelet. So what happens? The increased calcium level leads to formation of platelet fibrin plug. Okay. And in the body there are mechanism which will break down the clot, that is fibrinolysis. But if this mechanism is not sufficient, small clot agar banta hai, small clot, they will be broken down, but bada clot ban gaya, that is troublesome, that is pathological, that can cause myocardial infarction, that can cause deep vein thrombosis, that can cause stroke. So to prevent that, we are using the anti-platelet agents. Why we are using anti-platelet agent? To prevent the blood clotting, okay, prevent the blood clotting inside the blood vessel. So what are the anti-platelet drugs? So you know that one of the very first step towards the blood coagulation or clot formation is nothing but the anti-platelet, is nothing but the platelet aggregation. तो पहला स्टेप जो है ब्लड कोएगुलेशन में होता है प्लेटलेट एग्रीगेशन. तो उसको to prevent that, we are using anti-platelet drug. So they will prevent the activation of platelets. So anti-platelet drug, they will prevent the activation of platelets. Anti-platelet drugs will prevent the activation of platelets. So in that first class क्या है देखो. So in that first class is nothing but the COX inhibitors, or you can say thromboxane inhibitors. COX inhibitors or thromboxane inhibitor is aspirin. Then phosphodiesterase inhibitor, PDE inhibitor, known as a dipredamol. It is also known as cyclic GMP enhancer. Cyclic GMP enhancer. Cyclic GMP enhancer. Then third class is the ADP receptor antagonist. ADP receptor antagonist, also known as the ADP receptor antagonist or glutamic receptor P2, Y12 receptor antagonist. And third class, इसमें there are two reversible and irreversible. What are the reversible ADP receptor antagonist? Remember there are two drugs. पहला है Cangrelor and Tegagrelor. Cangrelor, Tegagrelor. They are the reversible type of ADP receptor antagonist. Now, irreversible type of ADP receptor antagonist is a ticlopidine, clopidogrel, and prasugrel. Irreversible type of ADP receptor antagonist. Then fourth class in the antiplatelet is a GP2B3A receptor antagonist. GP2B3A receptor antagonist, also known as a collagen receptor antagonist. In that, AB6 tipropiban and iptapibatide, ये तीन ड्रग है. Now, fifth class of antiplatelet drug is nothing but the PPR antagonist, paroxysmal proliferator receptor gamma, PPR gamma antagonist. The example is a Vorapaxar and Atopaxar. These are the antiplatelet drugs. ना important एक classification आ सकता है आपको. Remember COX inhibitor, aspirin, PD inhibitor, dipyridamole, because PD क्या करता है? It is involved in the metabolism of cyclic GMP. Then ADP receptor antagonist, reversible है Cangrelor, Ticagrelor. Irreversible है ticlopidine, clopidogrel and prasugrel. GP2B3A receptor antagonist, इसके ऊपर क्वेश्चन भी आ चुका है. AB6 मैप, ibuprofen, iptapibatide. And PAR मतलब paroxysmal proliferator, platelet activating receptor antagonist. This is a platelet activating receptor antagonist. Platelet activated receptor antagonist. Varopaxar and Atopaxar. Platelet activating receptor antagonist. So these are the class of antiplatelet drug. We will see the individual antiplatelet drug. So classification of antiplatelet or antithrombotic. So prostacyclin. Itself, they are the antiplatelet. Prostaglandin I2 means prostacyclin. Then thromboxane synthesis inhibitor is a aspirin. Then ADP receptor antagonist is a clopidine and clopidogrel. Phosphodiesterase inhibitor is a dipyridamole. GP2B3A receptor antagonist क्या रहेंगे आपके? AB6 मैप है ना, AB6 मैप, tipropiban, which is a non-peptide, and iptapibatide is a cyclic peptide. तो प्लेटलेट के ऊपर क्या है? प्लेटलेट कंसिस्ट ऑफ GP receptor, means glycoprotein receptor, which are a type of integrin receptor. So whenever there is injury to your blood vessel, there is a release of reactive protein like collagen from the blood vessel and von Willebrand factor. जब इंजरी होता है ब्लड वेसल को, तो कोलेजन रिएक्टिव प्रोटीन निकलता है और वोन विलेब्रेन फैक्टर भी निकलता है. तो दिस रिएक्ट विद द प्लेटलेट रिसेप्टर like a GP2B3A, GP1A, GP1B, and releases the pro-aggregatory vasoconstrictors like thromboxane A2, ADP, and 5-HT. A platelet receptor will undergo conformational changes, favoring the binding of fibrinogen and von Willebrand factor to this. This will result in the cross-linking of platelet aggregation and formation of primary platelet. Now to the primary platelet plug, other blood cells like RBC will trap and the formation of thrombus. If the RBC traps, they are known as a red tail, and if WBC and platelet are only present, known as a white thrombus. So antiplatelet drugs, they are effective in the arterial and venous thrombosis. Thrombosis मतलब क्या है? Formation of blood clot in the blood vessel. Now you can see over here, na? So how platelet will adhere to each other. Platelet adhesion to the vascular injury. Second step होता है activation of platelet, and third step होता है cross linking by fibrinogen. ये 3 स्टेप में होता है. How platelets will aggregate? Platelets will aggregate in a 3 step. Platelet adhesion to the vascular injury, activation of platelet by thromboxane 2 ADP and increased GP2B3A receptor. Then cross linking and fibrinogen means clot formation. So जो AB6 है, that will inhibit the GP2B3A receptor. Aspirin will inhibit the thromboxane A2, and clopidogrel will inhibit the ADP receptor, which are present on the platelet. Now we'll see individual drugs, antiplatelet drugs. पहला है आपका प्रोस्टासाइक्लिन और PGI2. Prostacyclins or PGI2. They are formed in the endothelial cells of blood vessel. They are also present in the brain, GIT and kidney. So prostacyclins, they are formed in the endothelial cells of blood vessel. मतलब जो inner layer जो होता है blood vessel का उसमें, but also वो brain में भी होते हैं, GIT में भी होते हैं, kidney में भी होते हैं. Prostacyclins. So it inhibits the platelet aggregation, causes the vasodilation, है ना, hypotension and bradycardia, headache, है ना. So brain में अगर प्रोस्टाग्लैंडिन बढ़ गया तो हेडेक होता है. प्रोस्टाग्लैंडिन अगर ब्लड वेसल में बढ़ गया तो ब्लड वेसल डायलेट होता है एंड ब्रैडीकार्डिया करता है, हाइपोटेंशन है. Their half life is very short, for 3 minutes. जो prostaglandin होते हैं, they will act only for 3 minutes. Half life is very short. Prostacyclins are now available for preventing the blood platelet aggregation during the hemolysis. जो hemolysis होता है आपका PG and the prostacyclins formulations are available now. Now aspirin क्या है? It is a NSAID, non-steroidal anti-inflammatory drug. It is acetyl salicylic acid. Remember, it is a COX inhibitor, है ना, once COX inhibitor. COX मतलब क्या होता है? साइक्लोऑक्सीजनेस. COX मतलब क्या है? साइक्लोऑक्सीजनेस. सो है ना, so COX will convert phospholipid into prostaglandins and thromboxane A2. COX क्या करता है? PG और thromboxane A2 में कन्वर्ट करता है. तो aspirin inhibit the COX. So it is a highly active against the platelet cyclooxygenase. Highly active against the platelet cyclooxygenase. It is a irreversible acetylator of COX-1. इसके ऊपर क्वेश्चन ऑलरेडी आ चुके हैं. It binds and inhibit irreversibly. It's irreversible acetylator of COX-1. Now remember, irreversibly acetylate the COX-1 and inhibit the thromboxane synthesis. But in a small dose, it inhibits the thromboxane synthesis. In large dose, also inhibit the formation of prostacyclin, जो कि मतलब हेल्पफुल होता है. In small doses inhibit the thromboxane synthesis inhibition, inhibit the thromboxane synthesis in a small dose. In large dose inhibit the prostacyclin formation. Now maximum platelet aggregation inhibition dose जो होता है, maximum platelet aggregation inhibition is shown in a dose of 75 to 150 milligram. ये जो dose है 75 to 150 milligram dose. In that dose aspirin inhibit platelet maximum. Platelet aggregation is inhibited maximum at 75 to 150 milligram in that dose. So that's why देखो it is useful in the preventing the myocardial infarction, angina, preventing the strokes. जिसको भी myocardial infarction होता है prevention के लिए ना, for prophylaxis prevention मतलब क्या है? Prophylaxis. Prevention means prophylaxis. Prevention means prophylaxis. For the prophylaxis of myocardial infarction, angina and stroke, we are giving the aspirin, acetyl salicylic acid is used to prevent the preeclampsia. Used to prevent the preeclampsia. Preeclampsia क्या होता है? It is a hypertension in the pregnant woman. Now next drug है desoxybane. कौन सा बेन? Desoxybane. So it is a substituted imidazole derivative which also blocks the production of thromboxane A2. ये भी thromboxane A2 inhibit करता है production, but without affecting the prostaglandin. तो ये तो ज़्यादा यूजफुल रहेगा फिर. But aspirin is a superior than desoxybane in terms of other, है ना, जैसे adverse effect वगैरह हुआ है. That's why aspirin is preferred more. क्वेश्चन आता है आपको, है ना, what is the mechanism? So it is a irreversibly acetylate the COX-1 and it is a used to prevent the myocardial infarction. So dose is a 75 to 150 milligram, that is inhibit the maximum platelet aggregation. Remember, okay. Now next drug is a ticlopidine. कौन सा pidine? Ticlopidine. Next drug is a ticlopidine. So is a thiopridine derivative that alters the membrane permeability and inhibit the platelet aggregation. So ADP receptor जो होते हैं, they are present on the membrane of your platelets. ADP receptor is present on the membrane of platelet and responsible for the platelet aggregation. So ticlopidine inhibit the ADP receptor. So it is ADP receptor inhibitor. It inhibits the platelet aggregation caused by ADP, then platelet activating factor, collagen and adrenaline. Irreversibly, it blocks the P2Y12 fluorogenic receptor. ADP receptor blocker है, P2Y12 type of fluorogenic receptor on the platelet. So ये जो ticlopidine है, it is a prodrug and its activity is because of its metabolite. Adverse drug reaction क्या करेगा? न्यूट्रोपेनिया, न्यूट्रोफिल का लेवल कम कर देगा. ए ग्रैनुलोसाइटोसिस, बेसोफिल, न्यूट्रोफिल, यूसिनोफिल, है ना, इसका लेवल कम कर देगा. थ्रोम्बोटिक थ्रोम्बोसाइटोपेनिया पर्पुरा, TTP, thrombotic thrombocytopenia purpura. It's more effective than aspirin, more toxic than aspirin and more expensive than aspirin. तो सबसे सेफ एस्पिरिन ही है. नेक्स्ट वन इज क्लोपिड्रोग्रेल. क्लोपिड्रोग्रेल सिमिलर टू टिक्लोपिडिन बट लेस टॉक्सिक होता है ये, बाकी सेम. देन नेक्स्ट वन इज प्रासुग्रेल. इट इज अ न्यू ड्रग that inhibit the ADP receptor P2Y12 fluorogenic receptor and blockage and a blocker. It is a ADP receptor blocker. Nowadays it is used, it is also prodrug. Nowadays increasingly used, it is a prodrug. Then ticagrelor is a latest P2Y12 receptor blocker. Also block the platelet aggregation by binding to the ADP receptor. Next one is the dipyridamole. So it acts as a vasodilator by inhibiting the enzyme phosphodiesterase. So it will increase the cyclic GMP, cyclic AMP. क्या होता है cyclic GMP का मेटाबॉलिज्म, cyclic GMP मेटाबॉलिज्म होने के बाद में cyclic AMP बनता है, उसका मेटाबॉलिज्म ना सॉरी cyclic AMP का मेटाबॉलिज्म होकर cyclic GMP बनता है. cyclic AMP का मेटाबॉलिज्म कौन करता है? phosphodiesterase enzyme. So it prevent the metabolism of cyclic AMP and increases the level of cyclic AMP in the platelet. You know. Okay. So inhibit the phosphodiesterase enzyme and increases the cyclic AMP concentration, prostaglandin concentration, increases the platelet inhibition. Block the adenosine also used in the along with the warfarin. Dipyridamole. So all they are the anti-platelet drugs. सभी क्या है? Anti-platelet drugs है. Okay. Now last class of anti-platelet drug is nothing but the glycoprotein 2b3a receptor antagonist. GP2b3a receptor antagonist. ये क्या होता है? This is a collagen receptor present on the platelets. Collagen receptor present on the platelets and known as a glycoprotein 2b3a receptor, GP2b3a receptor. So example is AB6-MAP. It is a क्या है? It is a monoclonal antibody. AB6-MAP is a monoclonal antibody against the GP2b3a receptor. AB6-MAP monoclonal antibody against the GP2b3a receptor. Inhibit the platelet aggregation and blockage the platelet receptor by blocking the platelet receptor. So it is effective as an antithrombotic agent in the myocardial ischemic syndrome. नया सिंथेटिक जो है GP2b3a receptor antagonist known as a tibrobeppan, which is a non-peptide in nature, and second one is a iptipeptide, which is a cyclic peptide. So they are also competitive inhibitor of glycoprotein 2b3a receptor. Next drug is nothing but the pentoxifylline. Pentoxifylline is an analog of xanthine, you know, जैसे आपका थियोफाइलिन वगैरह होता है कैफीन. So it is an analog of xanthine. It increases the deformities of RBC. Increases the deformities of RBC in the circulation and improves the microcirculation. It is a hemorrhagical agent. It is a hemorrhagical agent. इनकी यूजेस क्या है? All these drugs they are used for the prophylaxis. All these drugs they are used for the prophylaxis, means prevention, prophylaxis of clotting in case of coronary artery disease, in case of acute coronary syndrome, जैसे अनस्टेबल एंजाइना हो गया है, उसमें नॉन एसटी एलिवेशन मायोकार्डियल इन्फेक्शन, मतलब जो आपका है ना आपका होता है ही आपका जो ईसीजी होता है उसमें नॉन एसटी एलिवेशन मायोकार्डियल इन्फेक्शन, NSTMI, cerebrovascular disease, then prosthetic heart valve surgery. आपका हार्ट वाल्व चेंज किया वो टू प्रिवेंट द ब्लड क्लॉटिंग दे आर यूज्ड. arteriovenous shunts, then venous thromboembolism, peripheral vascular disease. So these are the uses of this एंटीप्लेटलेट ड्रग्स, एंटीप्लेटलेट ड्रग्स के यूज, एंटीप्लेटलेट ड्रग के यूज क्या है? दीज आर द यूज ऑफ एंटीप्लेटलेट ड्रग. Remember, these are the antiplatelet drugs. Antiplatelet drugs. Now these are the antiplatelet drugs which are finished. So antiplatelet drugs में क्या देखा है अपन ने, है ना? How, what are the classification of antiplatelet drugs? Then how antiplatelet drugs will act, है ना? Then after that we have seen the individual drugs, the important aspects for GPAT Niper DI Pharmacist from these drugs. Now next lecture we'll see the anticoagulant heparin and their heparin and other oral anticoagulants. Okay, today we are not having any response. बच्चे बहुत ही कम हैं इसलिए मैं अभी स्टॉप कर रहा हूँ. So it is a 45-minute session which is completed.